Prof. Wilson Tam. Prof. Tam has received a seed grant from us last year. He's working in some data from the emergency rooms in Singapore and Hong Kong, if I'm not wrong. And I think I'll just leave it to him to describe his project a little bit more. And I'm very excited to hear about the findings and the progress of the project we have thus far. So,
okay, so I'm now sharing my screen.
Yes.
Okay, can you see my screen?
Yes.
Okay, and can you hear me? I don't want I finish and then no one can hear me. Okay. Okay, so the topic today I'm going to talk about is the health risk assessment of air pollution. A tale of two cities. Okay, so I can only present the preliminary result today because I haven't completed the project. Okay, partly because the COVID now. So I will let you know what kind of difficulty I have over the last few months at the end of this presentation. Okay, today I am going to present the result of one of the city, the two cities. One is Singapore, the other one is Hong Kong. So I managed to get all the data from Hong Kong 2 to 3 months ago, and hence I can finish the not finish, mostly finish most of the analysis. Okay, but for Singapore data, I just got it 1 or 2 weeks ago. Okay, so I haven't cleaned the data. Okay, so today I will focus mainly on the preliminary result on the Hong Kong data. Okay, so to start with, okay, just wait. Okay, to start with, the first thing, of course, I need to introduce myself. Okay, I am coming from the LSD Center for Nursing Studies. Okay, so this slide is a request by our HOD to provide in every presentation. Okay, so I just briefly introduce NUS nursing. So we start our department in 2005, so 15 years ago. Okay, so we start to provide the we are the first institution to provide the full-time bachelor program for nursing. Okay, so now actually we are one of the largest department, I mean in terms of the student, because for every cohort, for the full-time undergraduate student, we have over 300 per year. Okay, so in terms of the full-time student, including undergrad and postgrad, we have around 1,200. Okay, if you include also those part-time students, because we are one of the department which also offer the part-time undergraduate study in NUS. So we would have 1,400 to 500 students. Okay, so it is about our department. Okay, then next I would like to talk about our research. So within our department, we divide into 4 different research group. Okay, so mainly related to health lab because we are from nursing school and underscore medicine. Okay, the first one is the chronic illness and long-term care. Second one is women and children health care. Third one, patient safety and quality of life. And then the fourth one, geriatric care and wellness. Okay, so some of you may have interest to collaborate, for example, geriatric care about elderly, and then chronic illness. Okay, so if you have any interest to this types of research, you are very welcome to contact us, okay, to see whether we can have any collaboration. Okay, so it is about the research in our department. Okay, for myself, I'm Wilson, so my background is in epi and statistics. So epi basically is to find out the cause of the disease. Okay, so for my research interest, basically, I am looking at those risk factors for cardiovascular disease. For example, how the sleep disorder would affect the occurrence of stroke, hypertension, how it would affect the MI or stroke, or air pollution, how it would affect the our health in terms of the cardiovascular disease. Okay, so today's topic basically would be the third one related to air pollution. Okay, here I just extract a few quotes from WHO last week. Okay, so you could see, for example, why air pollution is an important topic. For the first one, air pollution kills estimate 7 million people in the world every year. So you can see that actually it is a lot of people die due to they exposed to air pollution. And it is not only about the mortality. If you taking into account the hospital admission, okay, or absent from work, okay, due to sickness, okay, so sick leave. Okay, so actually it would contribute a large amount of resource of money, okay, due to air pollution. Okay, so today for my project, basically I am trying to look at the relationship between air pollution and hospital admission. So later I will present the method and the result. Okay, and then for air pollution, air quality actually is related to the climate change. Okay, because some of the source of the air pollution basically that would be the source for the greenhouse gas emission, and hence they are basically closely related. And hence, if we can find some way to reduce the air pollution, actually it can provide some win-win situation. Okay, we can lower the burden for the disease attribute to air pollution, and we can contribute to the long-term and short-term migration of the climate change. Okay, so it is just provide some basic information about air pollution to you to see why it is important to look at the problem. Okay, if you don't mind, I just extract the video from WHO. So it is just around 1 minute. Then I just try to play it. Okay, but please let me know whether you can hear it or not.
What causes 1 in 9 deaths worldwide?
Yes, can hear.
Affects 80% of people living in cities, but is often invisible. What leads to more than a quarter of deaths from heart disease, 34% of deaths from stroke, and kills almost as many people each year as the number of breaths you take? The answer: air pollution. Air pollution is the single greatest environmental health risk we face. It threatens our bodies, our climate, and our future. There are simple solutions to cleaning our air and cooling our planet. Let's tackle this global health crisis together in order to protect our planet and ensure a healthy future for all. Join us in breathing life back into our cities.
Okay, so very short video, but based on this, I think you would be able to know what is the problem of air pollution and then how it would affect our health. So basically, the cardiovascular disease and respiratory disease can be attributed to exposed to air pollution. Okay, sorry, let me go to the next one. Sorry. Okay, so I just make a very brief summary. So air pollution would increase the risk for respiratory and heart disease, cardiovascular disease. Okay, so actually there is a lot of study, no matter it is observational study or cross-sectional study, to explore the relationship between air pollution and different type of disease. Okay, so for Singapore, actually, we have not many study to study or we do not have a long-term study to study the long-term effect of air pollution to the health. Okay, so basically, my project, proposed project here is to establish the relationship between the air pollution and the health in terms of the A&E hospital admission. Okay, later I will provide the details now. But air pollution actually can impact people who are already ill. Okay, so for some people, if they already have a lung disease or heart disease, if they exposed to air pollution, it would increase their risk to go to hospital or even to die. Okay, so it is quite important. Okay, provide warning for those people who have some kind of disease. When there is a high concentration of the air pollution, they may need to avoid to go outside or reduce the amount of outside work. Okay, for children, because they haven't have a complete developed lung system. Okay, so they may be affected by air pollution. For elderly, because their immune system become weaker, and hence they may also be a vulnerable population. Okay, so what is the major source for air pollution? For some of them, actually, it is applicable to Singapore. Okay, inefficient modes of transportation. Okay, so when the polluted fuels, okay, used in those cars, for example, the motorcycle. Okay, usually you may see for some of the motorcycle, they emit some bad smoke. Okay, within the bad smoke, there would be some particulate, okay, PM or some nitrogen dioxide. Okay. Also, for some of the Asian country, okay, they may still use some fuels for their cooking, lighting, or heating, and hence it would generate a lot of air pollutants. Okay, for power plants and other waste burning, okay, it may also generate a lot of air pollutant, bad smoke, and so on. So these are just to give you some basic idea. What are the source for the air pollution? And then in the next one, I just captured this one 2 days ago from WHO. Okay, so what is this graph? This graph show you the attribute death rate due to ambient and the household air pollution. Okay, so you can see that, okay, for the US, Canada, Italy is quite okay because they have a very low death rate per 100,000 population. But in this area, for example, you can see, okay, in Southeast Asia, China, okay, if you look at the zoomed image, then you can see, in this area, actually, it is not that good in terms of the death rate. Okay, so why we propose this study at the beginning? Because we want to look at how Singapore, the air pollution issue in Singapore would affect the health of the population. Okay, but then we found that it may be more interesting to compare two cities. Okay, that's why we propose to have Hong Kong and Singapore together. And the most important reason is I come from Hong Kong, so I can get the data more easily. Okay, so in terms of the health risk assessment, okay, so basically for this kind of air pollution study, we are trying to establish the association between air pollution with different types of outcomes. Like the most extreme one is mortality. So we can look at the daily mortality and then the daily air pollution concentration and then try to establish their relationship using some statistical modeling. Okay, today I will present the second one to look at those A&E hospital admission. That means after the subjects or the patient go to A&E and then they transfer to the hospital. That means the inpatient. Okay, so today we are looking at this outcome. Now, of course, for some of the patient, they may not be that serious. They may just go to A&E for consultation and then they may discharge. Okay, so it is another outcome that one can look at GP consultation or whether they go to polyclinic in Singapore, okay, to see whether there would be increased number of consultation due to respiratory disease or cardiovascular disease. Okay, and then for a more general population, for example, in some of the cohort study, they would look at the absence from school or work to establish the relationship between air pollution and the health effects. Okay, in terms of the modeling, basically what I am trying to do, I am trying to compute the relative risk or relative risk reduction. They are the same thing basically. Okay, and this number can tell us what is the expected increased percentage of the outcome. The outcome can be mortality, hospital admission, and so on, with the increase of the pollution level. Okay, so based on the statistical modeling and the data we have, we would be able to quantify the increased risk of entering to admit to hospital, okay, when the air pollution level increase. Okay, so it is the basic idea of the project. Okay, so I just list a few common pollutants that would monitor across different countries. Okay, not only Singapore and Hong Kong. Most of the country they would measure, for example, nitrogen dioxide. Okay, so if you forget what they are, just have a quick look. Okay, if you still remember from your chemistry, then it is okay. Okay, for nitrogen dioxide, basically it would be emitted from the cars, bus, power plants, and so on, and it would. Okay, if you expose to NO2 for a certain of time, it would affect your airways and as well as the respiratory system. Okay, so be careful about NO2. For sulfur dioxide, actually sulfur dioxide is the level of sulfur dioxide is very low across those developed countries. For example, in Singapore and Hong Kong, the level is very low. Okay, because the source is basically from power plants and other industrial facilities, and hence because Singapore basically we don't have any large factory anymore. In Hong Kong the same. Okay, so SO2 would have a very low level. At the end of the presentation, actually I will show you the objective, air quality objective from a few different countries, and then the current mean level of pollutants in Singapore. So you will have a better idea. Okay, so how sulfur dioxide would affect people? It would affect the human respiratory system, make them be difficult. Okay, and then if it is children, it is more sensitive to SO2, especially if they have asthma. Okay, so it would make them have difficulty in breathing. Okay, and then ozone. The third one is ozone. Okay, ozone basically is not create. Okay, but create. It is a chemical reaction now of those NOx, that means nitrogen oxide, nitrogen dioxide, and so on, and then so organic compound. Okay, this gas or compound, when they were present under the sun, okay, then it would introduce some chemical reaction, and then it would introduce the ozone. So ozone is very special. Okay, it would have a high level in daytime, but the level would be very low at night. Okay, so usually when we look at ozone, we target on the daytime, for example, 9 to 5, okay, to compute the average. Okay, this ozone, and it would affect the heart. For example, you will feel chest pain if you continuously exposed to ozone, and then it would also affect your respiratory system, and it would make your airway with inflammation. Okay, so it is about ozone. The next two is PM10 and PM2.5. It is referring to the particulate matter. Okay, but the diameter is different. One is 10 micrometers. Okay, the other is those particulate matter with diameter less than or equal to 2.5 micrometer. Okay, this one, both of them actually you can directly breathe in and then go into your lung. Okay, and it is also generated from this one can be generated from sea salt. Okay, or dust. For example, if you remember, or there were some dust storm episode in China, Mongolia before. Okay, so if you measure the PM during the dust storm, it can be reached even 1,000, and the usual daily average for Singapore is around 30 something, 40 something. So you can see the difference can be quite large. Okay, and then it can be generated from pollen and other sources. Okay, but for PM2.5, it is considered more harmful because it would affect the premature mortality. So for those infants, if they breathe in the PM2.5, it may make them very uncomfortable. And then if it is in a very serious cases, they would die. Okay, increase hospital admission for lung and heart disease. Okay, PM10 is also the same now. Okay, but this one, because it is smaller, so actually when you breathe in, it can directly go into your lung. Okay, so it may make you feel more uncomfortable. Okay, so here I just list the few commonly monitored air pollutants just to let you have an idea. And I will use these 5 air pollutants as a demonstration in this presentation. Okay, so the rationale for this study mainly because there was no long-term study conducted in Singapore. Okay, and I found a few studies, but they look at the haze episode. So they would only look at after the haze whether there would be increased number of A&E emission due to the haze. So they just look at the average of the haze episode a few days after the haze episode, and then to look at the average number of emission compared with before the haze episode. Okay, so it is a very short time. Okay, but here we will try to use a longer time series to establish the relationship. Okay, and then why Hong Kong and Singapore? Okay, first of all, I'm from Hong Kong now. Okay, so I can easily access the data, and then now I work in Singapore. So these two, basically, I choose these two based on this, and of course, the size is comparable. The population basically is more or less comparable, and the GDP also quite similar. Okay, so they have a lot of similarity. Okay, so it is the another rationale that I prefer to use both data to make the comparison after I complete the data analysis. Okay, so I go to the method section. Okay, so this one is the about the how we get the daily A&E hospital admission. Okay, for the source in Hong Kong, okay, we request the data from the hospital authority in Hong Kong. Okay, in Hong Kong, the healthcare system is quite different to Singapore. So most of the hospital are under hospital authority. Okay, so the number of hospital beds in those hospitals actually cover more than 97%, and then the other 2.something% are from those private hospital. Okay, so for A&E, basically no private hospital provide A&E. Okay, so when we request the data from hospital authority, basically it covers all the A&E admission. Okay, and then for Singapore data, we request from the NUHS AI Discovery. Okay, so this one is a new platform for the researcher to request data. Now, previously, when I joined NUS in 2014, I tried to request the data, this kind of data from NUH, SGH, but they could not provide to me because there would be a lot of problem in terms of the identify the patient data. But now this you can consider this is a department or platform. Okay, they set up a new platform for us to request the data called AI Discovery. Okay, so it can be an independent department. So you can request from them. They would do the identification and then provide the data for you. Okay, so it takes quite a long time now, but still you can request the data from them. Okay, so because of this the establishment of this department, so I can request the data from there. Originally in the proposal, I proposed 2015 to 2019. Yes, for Singapore data, I still request 2015 to 2019. For Hong Kong data, originally I request from 2015 to 2019, but after we make the request, they told us that the same amount of money, actually they can also extract more data for us. Okay, so I finally extract from 2011 to 2019. Okay, so the period is a little bit different, but it doesn't really matter because we are trying to look at the long-term association. Okay, a long-term time series, not long-term association. And then the disease I am looking at West Nile disease. Here I just put down the ICD, International Classification of Disease. For each disease, there is a code. Okay, so I just put it here just for if you have any interest, then you can find out what kind of disease it is, and then based on the ICD code, we can request the data. Okay, so you cannot just give the name West Nile disease and then ask the organization to help you to extract. They would not. You must give them either the ICD code. This is the live version, or the ICD code 10 version, or other classification method. Okay, so here just some common disease that we would look for air pollution study. Okay, any respiratory disease, asthma, COPD, pneumonia, influenza, and then for cardiovascular disease, we would look at heart failure, IHD, CVA, and so on. Okay, so these are the common respiratory and cardiovascular disease. Okay, in terms of the daily pollutant concentration and weather information in Hong Kong, very simple. Okay, we don't need to request for the Environmental Protection Department. Actually, they post all the data in their website, but the only issue is that you need to download monthly. Okay, so one by one. Okay, and for air pollution in Hong Kong, for example, there are 8 monitoring stations. Okay, so you need to download the data or monthly in each of the stations, and then you try to compile them. Similarly, for the Hong Kong observatory, you can download the temperature and humidity directly, also in monthly basis. Okay, in SG, we can go to the NEA. Okay, so you can also download from there. Okay, so how I get this data is basically download from their webpage. Okay, the period is the same. Okay, for pollutants, I download these 5 pollutants that I mentioned before because they are the most commonly monitored across different countries. Whether I only download temperature and relative humidity. Actually, we can also download the rainfall and other weather information. But usually, for this type of study, we would adjust the temperature and relative humidity. Okay, so after that, I gather the data. I mean, gather all the Hong Kong data first. Okay, then I also need to create some additional variable. For example, day of the week, holiday indicator. Okay, because it is a time series, some kind of time series study. So I need to provide a day column, day of the week. Okay, the 8th here means the 8th day of 2011, okay, in January. Okay, and then it is Saturday and so on. Now, why we need to add the holiday indicator? Because in some city or country, okay, so during holiday, most of the GP would be coast, and hence more people would go to the A&E directly. Okay, so usually we would add the holiday indicator. Okay, now if there is any missing data from the monitoring station for the air pollution data, so how we clean the data, basically we follow the European approach, so using the weighted average from other monitoring station. So if the monitoring station is close to the one with the missing value, so it would be given a larger weight. Okay, so we follow this protocol to clean the data, especially for air pollutant. For the temperature and humidity, basically, there is no missing data. Also for hospital admission, there is no missing data. Okay, in terms of the statistical modeling, I will briefly introduce. Okay, because the dependent variable is the number of admission per day, so we would use Poisson regression. So it is a count data, so we use Poisson regression. But why Poisson generalized additive model? Because we want to adjust or to smooth the long-term trend of the admission. So we would use some smooth term in the model. No matter the time, I mean the data, the temperature, humidity, we would do some smoothing so as to filter out the overall trend. And then we also add the holiday indicator, day of the week indicator. Now, this is a general form for the core model. We call it core model. Okay, we develop each core model for each type of admission. Okay, for example, COPD, we develop one, asthma, we develop one, and so on. So one disease, one model. Okay, and then for using this kind of model, usually we will face the problem of over dispersion. So we would adjust it using something called causative likelihood function. And then because it is time series data, it may have some autocorrelation among the residuals. So we would examine the partial autocorrelation curve and then to add the autoregressive term if necessary. Okay, so for each of the pollutant, we will try different lag days. What does it mean? Okay, so you may have a high air pollution today and then you go to hospital, or because yesterday there was a high air pollution, then you go to hospital today. So it may have some lag effect. So besides testing the same day, we would test yesterday air pollution, 2 days ago, 3 days ago. Okay, for this demonstration, I only try up to 3 days. But usually for the complete analysis, it would try up to 5 days. And also there would be moving average between 0 to 1 day, 0 to 2 days, and so on. Okay, but for this presentation, I prepare up to 3 days. And then I will examine, assume if there is 10 microgram increase of each of the pollutant, then what is the relative risk would be. Okay, after I get the relative risk from this model, then I will compute the relative risk reduction. That is the relative risk minus 1. Okay, and then present the result using the RRR. Okay. All the computation, I use the R package to do it using the GAM package. There are other package you can fit the generalized additive model. I use the simplest or the commonly used one. Okay, so it is about the modeling. Okay, here are the summary of the result. So just let you have an idea. Okay, how many hospital admission would have due to how many A&E hospital admission would have per day. For example, in Hong Kong, the whole Hong Kong, due to respiratory disease, actually each day it would have around 300. Any cardiovascular disease, it would have 200. So basically, you can see due to respiratory or cardi, it would have 500 admission, A&E admission per day around this number. Okay, for the sub-disease, you can see the table here. Okay, so just to let you have an idea, okay, how many daily admission would be due to different disease. Okay, in terms of the pollutant, okay, so I just compute the daily mean. Okay, so for NO2 or 50 something, SO2 11, very low SO2. Or compare with those undeveloped or underdeveloped country, Hong Kong and Singapore is very low. Ozone, PM, and so on. Okay, so this is the relative risk reduction that I compute based on the model, and this one is for any respiratory disease. Okay, any respiratory disease, when the pollutant increase for 10 microgram. So what you expect, the number of the percentage of the hospital admission would increase. For example, the first table show you the result for NO2. Okay, and then I would highlight the one is the most significant one. Okay, NO2 COD, that means if today NO2 level is high, we would expect around 0.86% increase of the hospital admission due to respiratory disease. Okay, for SO2, none of them are significant. So I did not highlight. For ozone, one day, that means when yesterday ozone level increased for 10 microgram, we would expect today the hospital admission due to respiratory disease would increase for 0.9%. Okay, similarly, we have PM10 and PM2.5. Now, this 5 table for 5 pollutants are only for any respiratory disease. In the previous slide I show you, I will look into different diseases. Okay, so I provide a summary table in the next slide across different diseases. The first row is about any respiratory disease. It is for those who which I highlight in the previous slide here. Okay, this is the summary. Okay, for example, respiratory disease, we know NO2 is significantly associated with it. SO2 does not have any association, no significant association. Ozone with PM10 with PM2.5, or asthma, these two does not have, and so on. So it is a summary result. Okay, so for cardiovascular disease, basically all these 5 would have association for most of the cardiovascular disease, no matter it is any IHD or heart failure. Okay, so based on this table, you can see that for most of the cardiovascular disease, actually the admission would be associated to the increase of air pollution, no matter it is NO2, SO2, ozone, PM10, and PM2.5. Okay, so here I just provide a summary in the next slide, so it would be easier for you to understand the result. So most of the pollutants show significant association with the A&E admission. Okay, due to different respiratory or cardiac disease. Okay, and then the relative risk reduction for NO2, ozone, PM10, and PM2.5 range from 0.45 to 1.7%. I skip SO2 here because SO2, as I mentioned, the level is much lower. Okay, compared with other countries, and actually it is just 10 microgram, around 10 microgram per day, very low. Okay, so I just summarize the result. So for NO2, these 4 pollutants, the RRR would be around 0.545% to 1.7% when the concentration of this pollutant increased for 10 microgram. Okay, so if you convert it, okay, this percentage around 0.5% to 1.7%, on average 1%. So you would expect the daily mean admission due to these 2 diseases, the mean daily admission is around 300 and 200. So it convert for each pollutant, it would convert to around increase 3 admission or 2 admission per day. Okay, if you take into account these 4, so it may be in total, it may have 15 or 20 per day. So in terms of per day, it can have increased 15 to 20 per day. Okay, it seems a very small number. If you take 20 times 1 year, okay, 365. So it would be 6,000 something. Okay, so although the daily number is very small, actually it is a quite large effect. And remember, we only take into account those who admit to hospital after they consult the A&E. Okay, make a consultation to A&E, but we did not include those simply go to A&E for consultation. So you can expect actually the number can be much larger than this one if you look at A&E consultation, or if you look at those GP consultation or polyclinic consultation, actually the number would be much larger. Okay, so it is just a very brief summary of the result. And then I also want to let you know the air quality objective for different countries. Here I just quote a few. Okay, and then this mean number is based on our data to compute the daily mean. Okay, for Singapore, for example, NO2, the objective 1 hour cannot exceed 200 and then for SO2 daily cannot exceed 50 but you can see in Hong Kong or Singapore, the SO2 value is around the same, 10 to 15. Okay, so it is much lower. Okay, ozone, you can see that ozone the objective usually using 8 hours to make the guideline. So you can see, for example, in Hong Kong or similarly in Singapore, most of the air pollutant concentration actually is below the guideline. Okay, but whether it is good enough, you can still see from our result, it will still increase the number or percentage of hospital admission when the concentration increase for 10 microgram. Okay, so at least we can establish the association in this way. Okay, so what next? Of course, for this project, I will try to complete the analysis for both Hong Kong and Singapore in the next few months, and then I can make a comparison of the result. Okay, after that, we can consider. Okay, after that, we can consider to expand to other outcomes. For example, we will try to get some data, daily mortality data, okay, and then the polyclinic consultation, so that we would have a better idea how air pollution would affect this kind of outcome. Okay, and then we can also conduct, based on the result, actually we can conduct some economic loss analysis. Like this one, I saw it this morning. Okay, in India, actually the loss of economic loss due to air pollution, they estimate it would be a large amount. Okay, the detail would be available in their report. Okay, and then what is the last one? It is to explore to develop the air quality health index. Okay, so for some of the country or city now, for example, Canada, Hong Kong, some of the city in China, Taiwan, actually they have this air quality health index. Okay, so what is this? Based on the local data to develop a index usually from 0 to 10 to remind the citizen, okay, whether the air pollution is too high that it would be harmful to your health. Okay, so based on our data, if we can expand to the daily mortality and polyclinic consultation, we can explore to develop such index so that we can provide a warning for different people. Okay, whether they are still advisable to go out for doing exercise when the air pollution level is very high, for example. Okay, so beside this project that I'm doing, I also work with my collaborator in other projects. For example, we conduct a multi-country survey in terms of the knowledge, attitude, practice, and the willingness to pay for air pollution. So we include Singapore, Hong Kong, Taiwan, Seoul, Shanghai, Kuala Lumpur. Okay, so we use the same questionnaire across different countries, and we are now in the data collection. So we would know how much they would be willing to pay for the air pollution to reduce the air pollution level. And then we also assess their knowledge about air pollution. Okay, and then another project that we are exploring because we found this cohort. Okay, so it is about the cardiac arrest in Singapore. Okay, so whether the people have heart attack. Okay, so we want to establish an association between this one with the air pollution using similar approach. Okay, so it is something that we are doing at the moment. Okay, and then what kind of difficulty that we face in doing this particular project? Okay, the major difficulty is the DSRB application. That means the ethics approval. Okay, so during the last year, before the COVID, actually, for this kind of study, we expect the IRB application or DSRB application can be approved in 1 to 2 months. Okay, but due to COVID, okay, so this kind of project is not considered high priority, and hence it takes much longer than expected. Okay, after we get the approval, then we need to submit the data request, and also it takes quite a long time. It is similar in Hong Kong. The number of times that we get the data is much longer than before. Okay, this one. I just show you one paper that we recently published. Okay, this one is about the COVID-19 cases. This one we have already published the result, and because it is COVID-19 related, so the IRB, the DSRB approval, actually we can get it within a month. We submit the application actually later than this project. Okay, but we still managed to get it. So you can see actually because of the COVID-19, it would really affect the IRB application if your project is not COVID-19 related. Okay, and then another not difficulty but you can see that because of the modeling for each of the pollutant, each of the outcome, I need to one different model and then to get the result. So here you may see only one number for each of them, but for this one I need to do at least 4 model to compute one number. Okay, so you can see this table, only this table. Actually, I spend some of the times to create this one. Okay, so the computation is also an issue, and hence during the term time, it is quite difficult for me to concentrate in doing this. Okay, but I expect in the next few months, I can, because of the term break, I can complete the all the data analysis and then provide the full report, maybe in the later part of 2021. Okay, so it is something that I want to share today. Thank you for your attention. Welcome for any question and comment. Yes, please. Yeah.
Thank you so much, Wilson.
Yeah.
My name is Changi. Sorry, I was late.
Oh, so, no problem. No problem.
Yeah, I just have a quick question about it's more technical. There's one slide you show you talk about the visit to hospitals and clinic consultations, right?
Yeah.
And you use that as the measure of the effect of air pollution. But how? How? Because people who visit hospitals may not attribute their symptoms or their problems to air pollution. So there's some kind of what's the method to determine whether these are caused by air pollution?
Oh, okay.
Some allergy to something else, right?
Yeah. You're absolutely correct. Okay, so what we did, we smooth the time here. So it is trying to factor out those usual pattern in the hospital admission. Okay, and then based on this one, and then we add in the air pollution. So in the core model, actually we did not include the air pollution variable. Okay, we fit the model until it is relatively good. So we have the overall pattern of the hospital admission first. Okay, so and then we add in the air pollution variable. So if it is significant, that it may suggest so because it is some kind of retrospective study so we cannot confirm 100% where it is really due to air pollution, but at least we can find that there would be some linkage between them and then quantify in the relative risk. Yeah.
Okay, thank you.
So usually for this part, we are trying to factor out those seasonal variation. So and then we would be able to tell whether those additional one would be due to the additional variable that is air pollution. Yeah. This method is quite standard in this type of research. Okay, so it may or put it this way, it is basically the only method or only one of the few methods that we can use to establish the relationship between the two if you have given this set of data. Yeah, there may be some other things called time net model. It may also be used to establish the relationship, or a Riemann model. Yeah.
Okay.
Yeah, Olivia. Yeah.
Thank you very much. As Nathaniel predicted, I found it very interesting and really enjoyed it. So thank you very much.
Thank you. Thank you.
And a question about the so the interpretation of the results. You've given us the relative risk associated with a 10 microgram increase. So is that based around the mean level in each city?
Okay, so this one, because it is city specific, so we use our own data. So it is, yes, it is relative. If you increase the level of the air pollution for 10 microgram, then it would expect to have, for example, 0.9% increase in the hospital admission due to that disease. Yeah, so because the data itself is country specific, so yes, it is the relative to some kind of if you increase 10 microgram, it would increase the number of admission for 0.9%, for example. Yeah.
So I mean, one might expect that there would be sort of threshold effects, but is it possible to?
Yes, okay. So in general, okay, so actually you are right. So usually I just draw here. Okay, I go to the last slide. Okay. So usually we would expect there would be the air pollution, for example, would be something like this. Okay, usually in developed country like Singapore or Hong Kong, we would expect it is in this region. Okay, lower than the highest. Okay, so we may not reach the threshold. Okay, but for example, like SO2, we are very low level, so we may be in this region. Okay, so in this sense, if it is the really the correct, but it is the assumption the air pollution would be and the the relationship between air pollution and hospital admission. If it is really in this way, then we would be able to capture because our concentration is more or less in this region. Yeah. Of course, there would be a cap because you would not expect there would be, for example, there would be 1,000 admission per day. Okay. Yeah.
A second thought. Is there, how can we capture and how can we deal with the interaction between the health effects and behavior? So if people are better informed about air pollution, and then they do what they ought to do, perhaps, so if they're in the vulnerable group, they might stay inside or not take outdoor exercise or something like, or stay indoors and turn on the aircon. Then that would then reduce the impact on health. So do we know, how can we sort of take account of that, or especially if we're thinking about looking at the effectiveness of an intervention?
Yeah, I understand your concern. Okay, yes, for this kind of study, we cannot really tell, because the subjects itself, we don't have their personal data. If we want to really examine, usually people would conduct a prospective observational study, so that you would have a better idea, okay, whether the subjects really, they go out or they don't, did not go out. So they would provide, for example, a GPS checker, okay, for them to do it. Okay, so that we will have more information and then we can do it. But yes, you are right. For this type of study, we cannot, because we use the retrospective data, and then we don't really have the personal information of the subjects. Yeah.
It's very interesting. I'm sort of thinking more towards the future, that, you know, how can we build on these interesting results and link them to the other,
I can share
understanding of risks.
Yeah, I can share another project that I work with my collaborator. Actually, she is also the co-investigator for this project. So we are asking those participants to wear a GPS tracker as well as a air pollution monitoring, a mobile air pollution monitoring facility, just like a cell phone, the size is just a cell phone, okay, to take it every day, so that we can check where they go and then what is the air pollution level. Okay, so that we would have a better idea. That one is a pilot study. We would only recruit maybe 30 to 40 subjects at the beginning, so that we would have a better idea of where they go and then how much exposure they have during the daytime, or at night we assume they go home. Okay, so something like this. Yeah, so yes, we are doing something similar as what you think. Yeah, but you can expect if we want to do it in a large scale, it may be where we need a lot of resource to do it. Yeah.
Great, thank you.
Yeah, thank you, thank you.
Are there any more questions for Wilson?
Ned, I understand Wilson will be making the presentation to the governing board.
That's right. Yeah, I know.
Yeah. Thank you. Thank you for agreeing to that. We have this governing board meeting every quarterly, and usually at the beginning of the meeting, we will invite one researcher, usually a PI of SIGGRANT, to present. So thanks for agreeing to do this.
Yeah. So I will try to complete the analysis, and then next month I can present more. But the time period is short, so I basically would present the result.
And the time period is quite short. It's different from this one. In this presentation, you gave a lot of details. So normally we hope the researcher, the presenter will finish a presentation in about 10 minutes.
Yeah, sure. I will try to revise all of this. Yeah.
Yeah. So you try not to go into technical details. Just
I understand. Yeah.
the objectives, methodology, and key findings. Yeah.
Sure, no problem.
You like to know the relevance to the institute. You know what our institute does, and what's the potential or achieved impact to the society. Yeah.
Okay. Yeah, fully understand.
In your proposal, you already talk about possibility of establishing an air pollution index or something, right? Yeah. So is it going to be done or?
Okay, so it because for that one, besides using the hospital admission data to establish the relationship, I also need to use the mortality as well as the GP consultation. So if I complete the other two parts, then actually, yes, we can develop. But now we only look at the hospital admission. Okay, so we still lack two pieces of the result. Yeah, but yes, it is doable. Yeah.
Oh, it's doable. Then you can mention that.
Sure.
So there's something very tangible, kind of impact. Yeah.
Okay.
All right. So thanks again for the today's presentation, and we look forward to listen to you again. On
okay,
May.
Sure.
Okay. Anybody has other comments or what? No. Okay. If not, we can end the meeting. And for the staff in IPUR, you can stay. I just have a few minutes with you. The rest can leave. Yeah. Thanks, Wilson.
Okay. See you next time. Bye.
Bye. Thank you.
Yeah.
Bye.
Prof Ko, we have another meeting at now.
Oh, is it already 3? Oh.
Yeah, it's already 3.
Oh no. Okay. I just want to report some good news. I have got 1, 2, 3, 4, 5, 6 donors pledging 1,001.
So cool.
Yeah, and not only that, there's one guy who pledged 5,000 for next year.
What? So fast?
Because every year you will donate 5,000. He said, but he said you already donated to NUS to another fund this year.
Wow.
But he pledged another. He said he'll reserve next year for us.
Fantastic.
Okay, so I guess you guys can try this kind of method WhatsApp group. But of course, different group will have different way of telling them story.
Okay.
It's up to you to. I mean, no harm. Today is Earth Day, so I thought it's a good chance. Yeah. Okay.
Okay. We should join the other meeting.
Yeah. Okay. Right. Okay. Thanks.
Bye.
Bye.